Today we're going to do a general assessment. How are you today?
I'm fine.
Do you have any concerns
No.
that you wanted to talk about? Okay, and when you're talking to him and doing introductions, you want to check to see she's well groomed, alert and oriented, no deformities that's noticeable, and the mobility, make sure she can hold her head upright and everything like that. And then you would do height and weight. You would measure them and make them get on the scale. And then you would test their vision with the Snellen chart. You would have them put the card over one of their eyes and then read off the vision chart like we've done before. And then you would have them do it over the other eye. Then you would check all the vital signs, like check her pulse, blood pressure, oxygen, all that. Then you would start with the head, and you would just feel of her head and check her hair, and everything looks symmetrical. The hair looks good, good texture. I don't feel any lesions or anything like that. Then the face, you would look at her face. Everything looks normal there, symmetrical. Okay, I'm going to put my hands here. Can you open and close your mouth? You check her okay, do it again for me. Okay. And then you're going to palpate her sinuses. Do you feel any tenderness there?
No.
Okay. And the next thing we're going to do is look at your eyes. Okay. Just look straight ahead for me. And you would want to check for Perla. Okay. And then we're going to do the Rosenbaum chart. Can you cover up one of your eyes and read the smallest line you can?
2843.
Okay. And then you would do that on the other side. Then you want to check for accommodation. Can you just follow this pin with your eyes? Okay. Then I need you to cover up your right eye, and I'm going to cover up my left eye. Now I'm going to move my fingers, and you tell me when you can see them, okay? Okay. Then you would do that on the other side. Then you would check the 6 cardinal fields. I need you to follow my finger again. Okay, and everything looks good there. Then you would want to check for the red reflex. Then we need to dim the light.
Which one is it?
Okay. And then we would observe again in the dark. Okay. Next, we're going to look at the ears. We're just going to palpate them, make sure there's no tenderness. Is it tender at all?
No.
Okay. No abnormalities there. Then I'm going to look in her ears. Okay. Everything looks good. Now we're going to do the whisper test. Can you put your finger in one of your ears and wiggle it? Okay. Then I'm going to whisper 3 numbers on this side, okay? Okay. Can you tell me what they were?
842.
Okay. So she done that right, and you would repeat that on the other side. Then we're going to do the Weber test. I want you to tell me if you can hear it more in one ear or equal in both ears. Did you hear equal?
Equal, I think.
Okay. Now, can you hear this?
Mm-hmm.
Okay, tell me when it stops.
Now.
Okay, can you hear it now?
No.
You can't hear it now?
No.
Okay. And then next we would do the nose. Now I'm gonna put one side of your nose and try to sniff in on the other side. Okay. Now we'll do the other side. All right. Is that okay? Okay. Then I'm gonna look in your nose. Okay. All right. And everything looks good there. Now we're gonna check the sense of smell. Close your eyes for me and see if you can tell what this smell is.
Lemon.
Okay. Then we're gonna check the mouth. I'm just gonna look at your lips and your gums and your teeth if you can open up for me. And normally you would have gloves on so you can open up. All right, now I'm gonna look in your mouth if you can say ah. Okay. Now I'm gonna check your gag reflex. Okay. All right, now if you can close your eyes again, I'm gonna check your taste. Stick out or open your mouth. Now you tell me if this is salty, sweet, sour, or bitter.
Bitter, I guess.
Okay. All right. And now we're gonna palpate the lymph nodes all the way down. Okay. Then we're gonna look at the neck, and we're gonna palpate the trachea and the thyroid. Okay. Can you put your head to your, or your chin to your chest? Okay, now can you put it back? Okay, can you lean it to the left and lean it to the right? Okay, now I'm gonna put my hand there and try to lean your head to the left again. Okay, now the right. Okay, now try to shrug your shoulders. There you go. Okay. Now I want you to do some things with your face. Can you clench your teeth? Okay, can you smile? Can you close your eyes? Wrinkle your forehead? Puff out your cheeks? Okay. Good job there. All right. Then I'm going to palpate your carotid pulses. All right. Then I will listen with the bell for bruise. Okay. And everything sounds normal there. Then next, I'm gonna, we would want to feel of the other lymph nodes all the way in the, down the arm. And we would do that on both sides. Now with you sitting down, first we're gonna look at your back, if you can turn around this way. Okay. And we're gonna look at the skin, make sure everything's symmetrical. I'm gonna palpate the spine, and then you would want to percuss the spine. Then palpate the scapula. Then can you take a deep breath for me? You'd want to check for thoracic expansion. and then tactile firmness. Can you say 99 for me?
99,
Keep saying it.
99, 99, 99.
Okay. And then you would want to check for diaphragmatic excursion. You would percuss down here. And then you would draw a line, but I'm not actually going to draw a line. You would draw 2 lines and then measure the distance in between. And you would do that on both sides. And then you would check for tenderness over the kidneys. Is there any tenderness there?
No.
Okay. Then you would want to just take some normal breaths for me. You would want to look at the lungs, make sure, check respiratory rate, make sure that the breathing looks normal there. Then we would want to, we want to percuss. And then we'll listen. And we would do that all the way down. Okay, then we would look at, you can turn back around now. We would look at the front of the chest the same way we did. Make sure everything looks normal with that. Then I would palpate and try to find the point of maximal impulse. Then I'm going to listen for lung sounds on the front after I percuss again. The same as we did on the back. Then we would listen all the way down. And then we would listen to the heart sounds. And you would do that all the way down. Okay. Then I need you to lay down. Okay. Then you would first inspect to make sure you don't see any pulsations that shouldn't be there. Then we would check for jugular vein pressure with 2 rulers. Okay. Then we would listen to the heart sounds laying down. Then I know you can't see very well in the video, but we would have her lay on her left side and listen to her heart again, but you won't have to do that right now. We're just going to pretend. Okay, next we want to look at the abdomen, and you just look at it. Normally you would not have any clothes on the stomach. Just inspect it. Everything looks normal. I don't see anything abnormal there. Then you would listen for bowel sounds. Then you would listen with the bell for bruise.